It's nice to have you join me again on this week's episode of Health Business. Our mandate on this program is to keep you informed on latest happening in the health sector. I'm your host, Oluwatoyin Kolawole. First on the lineup is the news. Stay tuned. Pharmacists in Nigeria are calling on the federal government to fulfill its promise of implementing the collectively bargained agreements in salary structures reached with the executives of the joint health sector unions since 2009 in order for peace to reign in the health sector. The pharmacists say the only way to put an end to the incessant industrial action by the health workers in Nigeria is to accede to the demands of the workers. This was part of the deliberations at this year's annual luncheon and award night organized by the Lagos chapter of the Pharmaceutical Society of Nigeria.
It's just a pity that in Nigeria we tend to do things in an haphazard manner. How can a particular professional group try to dominate every other group? All in the name of saying because they spend longer years in school. Healthcare delivery is a teamwork. And I remember in those days, in the, I think early 90s, early 80s, that was before this Oleko Iranson became minister. Then my understanding then was that both the pharmacist and the doctor, they enter on the same grade level. The only thing that differs is the step. But somebody just overnight increase the salaries of the medics astronomically, and you expect that there will be peace in that sector. No. And again, what is even in contention now, if you really look at it, USU is saying that, okay, you adjusted COMEX. They are not saying they wanted government to pay them what they have inside COMEX. They wanted COMEX to be adjusted by the same proportion. And somebody is not fighting because the amount is being paid is not enough.
You have COMEX for doctors, CONHES for others, whatever name you call it. As long as the parity is not there, we will always quarrel. Because I will not sit down and a colleague of mine who is a medical person is collecting 10 times what I am supposed to. We will continue to. So the only way is go back to the unified salary scheme. Because just as they have said now that if they attend to us, they will go on strike. If they attend to them again, we will go on strike. So as they increase their own, they must increase our own. But the unfortunate thing that they have been doing, which is very, very mischievous, very, very unjust, is that when the doctors go on strike within 14 days, 10 days, they give them what they want. But when the others strike, oh, we are coming, we will agree with you. And they have been on, we are coming. They have been putting us to, we are coming. For the doctors have been enjoying increased salary scales for the past 25 years, while the others are still where they are. I mean, that one cannot, it is not fair. It is not fair.
You will recall that the joint health sector unions, which comprises pharmacists, physiotherapists, medical lab scientists, imaging scientists, health information managers, and other related professionals, embarked on an industrial action 14 days ago after their meeting with the federal government ended in a deadlock.
Recently, Nigeria joined the rest of the world to commemorate this year's World Malaria Day. Many organizations put together events to mark the day. One of such events is the medical outreach and sensitization program organized by community pharmacists in Igondo area of Lagos State. Please watch the documentary.
Without doctor's prescription, all on doctor's attention. If you need solution, so much is given, much is expected.
According to the World Health Organization, this year's World Malaria Day, themed Ready to Beat Malaria, this theme draws attention to a stall in the progress made towards eliminating the world's oldest disease despite previous global successes recorded in the fight against malaria. The parasite does not only affect the human body, it has continued to cripple the economic development of the African continent. In Nigeria, the financial loss due to malaria annually is estimated to be about 132 billion naira in form of treatment costs, prevention and loss of man-hour, among others. This is why the Association of Community Pharmacists organized a sensitization campaign on the dangers of malaria in Igondo, a suburb of Lagos, southwest Nigeria. The organizers say the medical outreach became relevant because malaria is responsible for 60% outpatient visits to the various health facilities, with 30% childhood death, 25% of death in children under 1 year, and 11% maternal death in Nigeria.
What we are doing differently this year is to make people to be more aware of the prevalence of malaria and the causes and the prevention, so that people will be more aware, and we are getting to the grassroots to involve more people to be aware of the prevalence of malaria and the deleterious effects of malaria on their health.
So we're looking at different areas as well.
the mothers who are pregnant and little children below 5 years who are more vulnerable to malaria attack. So we are looking at educating this sect of people and telling them more about how to prevent malaria.
Our major aim is national development. We want the Nigerian populace, people in our community, to be very healthy. When they are healthy, they go on with their daily activity, and at the end of the day, we have a very healthy nation.
The pharmacist maintained that malaria remains a leading cause of morbidity and mortality in Nigeria, and with 97% of the population at risk.
There are some prevailing symptoms that are, that are common with everyone, like chills, fever, and then this fever are usually periodic. Maybe during the time of the day, a particular time of the day, they begin to feel feverish. It could be malaria, and headaches, then loss of appetite. Sometimes they may be vomiting, diarrhea. So some of these symptoms will actually help them to have an idea that they have malaria, but the true test is for them to, do a confirmatory test. There's a rapid test which we are doing right now to be able to determine if they have malaria or not before they are treated.
They also explained that Nigeria accounts for 32% of the global estimate of 655,000 malaria deaths annually. Victims are mostly pregnant women with their unborn babies and children below the age of 5 years.
We advise that the community should follow the laid down rules by the government. They should use they should use mosquito net to prevent malaria. And also, if anybody is infected or possibly anybody assume is infected, he should go to the health center and seek for appropriate advices.
Beating malaria and kicking it off totally can only be achieved by all and sundry. It's not something that is limited to health professional alone. Populace, I'm talking about the public, they have role to play. The professionals, doctors, pharmacists, everybody have role to play, and even the government. For example, governments have role to play in that they are supposed to ensure that they create enabling environments, do what they are supposed to do, ensure that the drainage system is adequately managed so that water free flow.
The residents were screened of different health conditions such as malaria, high blood pressure, diabetes. Free drugs was given according to each person's test results. Free mosquito-treated nets were also distributed to the residents. It is believed that malaria scourge can be eradicated if residents keep their environment clean and government on their own part increase campaign on the dangers of malaria.
Do you know that jaundice is one of the leading causes of neonatal death? What are the symptoms of jaundice? Watch our Mother and Child segment to get all the answers.
Infant jaundice is a yellow discoloration in the newborn baby's skin and eyes. Infant jaundice occurs because the baby's blood contains an excess of bilirubin, a yellow-colored pigment of red blood cells. Infant jaundice is a common condition, particularly in babies born before 38 weeks gestation. Infant jaundice usually occurs because a baby's liver isn't mature enough to get rid of bilirubin in the bloodstream. In some cases, an underlying disease may cause jaundice. Yellowing Thickening of the skin and the whites of the eyes is a sign of infant jaundice that usually appears between the 2nd and 4th day after birth. If the skin looks yellow where you pressed, it's likely your baby has mild jaundice. If your baby doesn't have jaundice, the skin color should simply look slightly lighter than its normal color for a moment. Examine your baby in good lighting conditions, preferably in natural daylight. The American Academy of Pediatrics recommends that newborns be examined for jaundice during routine medical checks and at least every 8 to 12 hours while in the hospital. If your baby is discharged earlier than 72 hours following birth, make a follow-up appointment to look for jaundice within 2 days of discharge. Call your doctor if your baby's skin becomes more yellow. If the whites of your baby's eyes look yellow, your baby is not gaining weight or is feeding poorly, or when your baby makes high-pitched cries.
Dear viewers, health business need your support in terms of advert placement and sponsorship to keep this program on air. Please call the number showing on your screen to save this program. Next on the lineup is regenerative medicine with Dr. David Ikudaisi. Stay tuned.
Hello, welcome to today's episode of Regenerative Medicine. I am Dr. David Ikudaisi, and if you are watching this program for the first time, I would like to bring to your attention or explain to you briefly what regenerative medicine is. This is a game-changing area of medicine with the potential to fully heal damaged tissues and organ, offering solutions and hope for people who have conditions that today are beyond repair. With the help of regenerative medicine, we doctors can now offer hope in some areas to patients who have already lost hope, because there is now solutions to some conditions that were previously thought to be like death sentence. First of all, I want to bring to your attention or explain to you that when I mention regenerative medicine, I'm talking about 1, platelet-rich plasma therapy, and 2, adult stem cell therapy. There are other types of stem cell therapy, but they don't have clinical applications today. And 2 good examples of that is the embryonic stem cell therapy that has a lot of controversy because of the involvement of the embryos or potential human beings. And the other one is induced pluripotent stem cell therapy. That is when you take fibroblast or skin, for example, to the lab and reprogram it to behave like embryonic or grow tissues like nose, hair, from that skin sample. Those two, that is embryonic and disproportionate, do not have clinical applications as of today. But adult stem cell therapy has been proven to be safe. Likewise, platelet-rich plasma therapy, also known as PRP therapy, is blood that has been concentrated to have 5 to 10 times the amount of platelet. And platelets are cells in the body without nucleus, but they do contain growth factors and cytokines. These, when released into the body, they stimulate proliferation and regeneration of the damaged tissue. They are safe because it's your own blood being used to treat you, so there's no risk for rejection. As for the adult stem cell therapy, to use that, you need stem cells that have to be extracted from the bone marrow or the fat, and the most common source of the fat is the abdomen. Adult stem cell therapy can benefit diabetic patients, whether it is type 1, which is most commonly autoimmune disorder, or type 2. Studies have shown that patients will either get off the diabetic medications or at worst be on minimal dose of the diabetic medication. Adult stem cell therapy can also help patients with kidney disease, either acute or chronic kidney disease. It can also help patients with a heart condition, either after a heart attack or with congestive heart failure. It can help patients with autoimmune disorder, and the list is long. That is things like rheumatoid arthritis, lupus, scleroderma, which is a condition of the skin, multiple sclerosis. What adult stem cell does is it modulates the immune system. So we call it an immunomodulatory effect. Stem cell generally helps to regenerate any part of the body that has degenerated. And by doing so, if there's any condition that is going bad in the body that the patient does not know yet, when you get adult stem cell therapy, it repairs those conditions before you even become aware of it. So that's why sometimes doctors will refer to it as anti-aging, because one day we're all going to die, but I believe most of us want to die with good health and good condition. That is why adult stem cell therapy is considered an anti-aging treatment. It helps with memory, seizures, patients with cerebral palsy. I mean, the list is just on and on and on. But it does not cure most cancers. It doesn't cure HIV, and neither does it cure hepatitis. But it may help patients with liver condition as well. I hope I've been able to educate you on what regenerative medicine is all about and what it can do for you or your loved ones. I am Dr. David Ikudayisi, and I'm looking forward to seeing you at next week's episode. Have a nice weekend.
end of today's episode of Health Business. For placement of advert and sponsorship, please call the number showing on your screen. Remember, living healthy is a serious business. I'm your host, Oluwatoyin Kolawole. Until next week, where we bring you fresh package. Bye for now. Thank you.